Hi guys, welcome to Dr. AI YouTube channel. In this video, we are going to talk about anatomy of breast. Breast is present in both female and male, but in male, this is a rudimentary organ and is functionally a part of reproductive system. Breast is conical or half spherical in shape and its size and shape vary with the age and position. So, there are two main parts in the breast as the base and the apex. So, the space of the breast lies over anterior thoracic wall and this space fixed to skin and underlying fascia by fibrous connective tissue bands called as Cooper's ligament. And also, this base of the breast is separated from pectoralis major muscle by fascia posterior capsule. It is known as retromammary space. So again I'll tell about the base. Base lies over anterior thoracic wall and fixed skin and underlying fascia by Cooper's ligaments. And this base of the breast is separated from pectoralis major by retromammary space. So now let's talk about the apex of the breast. Apex consists with two parts as nipple and areola. So here in red color spot you can see the nipple and around that you can see the areola. Nipple is present at fourth intercostal space and it is very small and conical in shape. In this nipple there are no hair, fat or sweat glands and it is composed of circular smooth muscles. This point is very important as in nipple there are no any hair and there are no fat or sweat glands in that. Areola is the part around the nipple and it contains dark pigment and this pigment intensifies with pregnancy. And also it is consist with circular and radial smooth muscle fibers. This cause nipple erection. And this areola contains large sebaceous glands, sweat glands and areolar glands. These large sebaceous glands lubricate the areola and the sweat glands help in thermoregulation and areolar glands lubricate areola and enlarged in pregnancy. And here areolar glands are also known as tubercles of Montgomery. So this gland contribute in lubricating the areola and they enlarged in pregnancy. So now let's talk about the structures present inside the breast. So a breast contains of 15 to 20 lobes. Here you can see the lobes. And for each lobe there is one lactiferous duct. When we talk about this lobe, it composed of so many lobules. So lobe is consist with lobules. So here you can see alveoli. These alveoli consist in the lobule like a bunch of grapes. So I'll explain it again. There are 15 to 20 lobes inside the breast and lobes consist of lobules and lobules consist of alveoli. I already told that there is a lactiferous duct for each lobe and here you can see lactiferous sinuses. This lactiferous sinus is also known as ampulla. So these are expanded portions of lactiferous duct that can temporarily store milk. So these lactiferous sinuses can temporarily store milk. And they are situated just beneath this areola. So the other thing is adipose tissue. It lies between the spaces of this lobe. So in these spaces you can see the adipose tissue. And here are the ligaments that anchor the breast. They are known as Cooper's ligament. It is arise from the connective tissue in this area. So that's all about the anatomy of breast. In next video, we will discuss about the location of the breast.